Opioids are everywhere, but so is Magellan. During this presentation, I'm going to walk through the myriad ways Magellan Health, and Magellan RX Management in particular, is addressing the opioid epidemic. Now, it's important to note that we haven't solved the problem. In fact, nobody has, given its massive scope and complexity. However, as a leading pharmacy benefits manager with deep roots in behavioral health, we feel that we are particularly well positioned to tackle this challenge head on, and as such are diligently building and deploying a suite of diverse and complementary strategies to do our part in guiding humanity through this epidemic to lead healthy, vibrant lives. The opioid epidemic gripping our country today is one of unprecedented proportions. Over 115 Americans lose their lives every single day to prescription and non-prescription opioid overdoses. It truly is a national crisis that affects public health and the social and economic welfare of our entire nation. The Centers for Disease Control, or CDC, estimates that prescription opioid misuse alone accounts for a total economic burden of about $78.5 billion annually. This factors in elements such as healthcare costs, treatment for addiction, lost productivity, and the time and resources expended by the criminal justice system. However, this isn't just a cost issue. It's a human issue, as this crisis does not discriminate in whom it touches. As such, it is critical for all stakeholders, ourselves included, to make a concerted and coordinated effort to deliver holistic solutions aimed at addressing the root causes of the problem, while providing wraparound services to those already impacted. To that end, Magellan Health has worked diligently at the enterprise level to develop a robust product portfolio that leverages expertise in clinical management, pharmacy, behavioral health, and technology. Our comprehensive approach meets patients and their providers wherever they are in the cycle of opioid use, before opioids are prescribed, when they are prescribed, and when opioids become a problem. Another way of looking at this is through the lens of three core areas: prevention, treatment, and recovery. At Magellan Health, we offer preventive solutions such as chronic pain case management, in which members are supported by personal coaches and digital therapy in managing their pain with non-opioid options. Our specialty benefits management programs assist patients and providers with finding the lowest level of intervention for a specific issue, thus minimizing the need for treatments that may lead to unnecessary opioid prescribing. Our behavioral health solutions proactively identify and address conditions that may lead to dependence or abuse through case management, screening, virtual care solutions, and digital cognitive behavioral therapy. Now, from a treatment perspective, Magellan RX's philosophy is to implement evidence-based strategies to ensure that the right patient receives the right drug at the right dose, at the right time, with the right monitoring and follow-up plan. This ensures the highest likelihood of a favorable treatment outcome with minimal risk. We accomplish this in a number of different ways: via clinical edits, dosing limits, comprehensive prior authorization criteria, patient and provider education, and advanced analytics and support services. On the recovery front, Magellan Health offers specialty managed care plans and carve-out programs to treat the whole patient. They also offer care management programs that utilize specialized opioid addiction pathways and peer support interventions to deliver coaching, encouragement, and connections with the community. Our focus for the remainder of this webinar is on what Magellan RX Management is doing today and in the future to transform best practice recommendations into reality. Once the true impact and full scope of the opioid epidemic came to light, in general, the healthcare industry as a whole has rallied around crafting solutions that align with expert recommendations. These include those proposed by the CDC in 2016 regarding the management of chronic pain. At Magellan RX Management, we are encouraged that, like us, other PBMs and payers have been striving to do the right thing, as it will take a concerted and coordinated effort across healthcare entities to impart meaningful and lasting change. Speaking of MRX specifically, we offer a number of interventions and strategies for promoting the appropriate prescribing and utilization of opioid medications. Our overall management philosophy focuses on a few core pillars. The first of these pillars is ensuring that the right members are receiving the right drugs at the right doses. We do this through enhanced point-of-service edits and utilization management criteria. This is accomplished via clinical edits, dosing limits, and comprehensive prior authorization. Secondly, we provide support to members on therapy through claims review, provision of educational support, and referral to enhanced services. We use digital member tools, clinician outreach, and toll-free hotlines to ensure that members and their caregivers are connected with the appropriate targeted services. And finally, We perform regular claim surveillance and advanced prescriber-level analytics to identify outliers and provide evidence-based academic detailing to positively impact prescribing patterns at the population level. Together, these key elements comprise a cohesive, comprehensive suite of solutions that are rooted in evidence-based care. Now, I'm going to discuss in a bit more detail the specifics about how we are approaching pharmacy-based utilization management of opioids. I'll also share representative results for our commercial employer customers who have adopted our standard management strategy. Now, a critical piece of managed care is identifying potentially problematic situations at the point of sale and escalating for further review prior to dispensing to the patient. To that end, we maintain a set of configurable edits and dosing limits for opioid medications. These are flexible in that their specific triggering thresholds may vary by line of business or even look slightly different for states, which maintain specific regulatory requirements around opioid coverage. However, they share a common thread in their overall intent and broad areas of focus. The examples listed here on this slide aren't necessarily exhaustive. They are, however, representative of the types of factors considered at the point of sale when adjudicating opioids for coverage on the pharmacy benefit. We look at such things such as limiting daily morphine milligram equivalent dosing, or MME, is a very common strategy, as high doses, especially those above 90 MME, increase the risk of respiratory depression and overdose in a patient. In fact, the CDC recommends avoiding doses above 90 MME if possible, and recommends exercising caution when increasing dosages above 50 MME. Duration of treatment, number of claims within a certain time period, quantity limits, specific types of opioids, and duplication of therapy are all incredibly important considerations. These elements are even more effective when deployed in tandem with a comprehensive set of clinical coverage criteria that appropriately enables access to opioids for patients who truly need them, while balancing and ensuring that evidence-based treatment and monitoring is being delivered by the treating provider. When opioid therapies are flagged at the point of sale for further review before dispensing to a patient, they undergo a thorough review by one of our clinical pharmacists in accordance with our evidence-based coverage guidelines. Now, the ultimate aim of our utilization management approach is not to arbitrarily and unilaterally restrict access to opioids. Rather, it is to facilitate evidence-based prescribing, alignment with expert guidelines, and appropriate monitoring of patients to reduce the risk of dependence, abuse, addiction, and misuse. These comprehensive prior authorization criteria were developed in collaboration with national pain management specialists and key opinion leaders, or KOLs, and approved through our National Pharmacy and Therapeutics Committee, or P&T. We check for things like appropriate diagnosis, urine drug screens, pain contracts, verification that the prescriber has registered and has checked the state prescription monitoring program prior to prescribing treatment and also during ongoing therapy, trial and failure of non-pharmacologic and non-opioid options, the absence of high-risk medications such as benzodiazepines and skeletal muscle relaxants, no prior history of overdose, and co-prescribing of opioid reversal medication, such as naloxone, in high-risk patients. Now, the exact criteria for approval may vary slightly based on the line of business or underlying comorbidities, such as active cancer pain, but the overall theme is consistent, ensuring that the patients receiving opioids are truly appropriate for therapy and have the right treatment regimen with the right monitoring and support. Not only is our approach clinically sound and evidence-based, but it's delivering real and meaningful results for our clients and patients. In December of 2016, we implemented a set of enhanced edits and prior authorization criteria that align with the concepts I discussed earlier as a standard approach in our commercial employer block of business. Specifically, we required prior authorization in the following circumstances: for all long-acting opioids, regardless of dose, for any patient who filled 2 or more claims for short-acting opioids in a 29-day time period, and for any patient with a single claim for greater than a 30-day supply. The intent here, in keeping with our overall philosophy, was to identify patients who appeared to have chronic pain and ensure that they are being appropriately treated and monitored, while also capturing patients out of the population who appeared to have chronic pain based on their fill patterns, but didn't actually carry a true chronic pain diagnosis. This enabled us to then ensure that they had the appropriate treatment plan on board for their true diagnosis. Now, doing a pre-post analysis and controlling for enrollment in the roughly 600,000 employer lives with our full suite of utilization management strategies enabled, we've seen incredibly strong improvements in key opioid claims metrics across the board in many important areas. To highlight some of these, we've seen an 11% decrease in opioid claims per 1,000 members per month. We've also seen a 16% decrease in opioid claims per utilizer, a 21% decrease in long-acting opioid patients per 1,000 members per month. We've also seen a 5% decrease in the average daily MME per claim and MME per utilizer. Even more impressively, we've seen about a 14 to 15% decrease, respectively, in claims for greater than or equal to a 50 MME and 90 MME. As I mentioned earlier, these are typically regarded as the risk thresholds for opioid prescribing on a daily dose perspective by the CDC. Also impressively, we've seen a 280% and 241% increase in naloxone prescribing among these high-risk patients above 50 and 90 MME, respectively. Now, another thing to consider here, when put in the context, is that these improvements are anywhere from 2 to 30 times that of a control group of our employer lives without any of our management strategies deployed. We are excited about these results, but they're just the start. We remain committed to continuous quality improvement, to refine our approach and develop new solutions. Our utilization management strategy is an important tool in our box of opioid solutions, but we don't stop there. Equally important is how we harness the incredible power of data and analytics to drive targeted clinical interventions and improve outcomes for patients. Our analytic and outreach approach is multifactorial, but it ultimately hinges on a suite of sophisticated algorithms. These are applied against both pharmacy and medical claims when available to identify potential outliers and the best opportunities for clinical management. These can be prescribers, pharmacies, or patients. We leverage these data to provide best-in-class reporting and analytics services to our clients so they get a population-wide view of their opioid utilization, but they're able to maintain the specificity and flexibility of drilling down to the individual patient level to drive tailored interventions and care plans. We provide expert-level outreach through our team of clinicians, which includes pharmacists, case managers, social workers, and nurses, many of whom carry additional certifications in areas like psychiatry and pain management. These interventions are conducted via many channels of varying intensity and complexity, from simple mailings to face-to-face encounters. We employ a high-touch, academic detailing program that's centered on alerting prescribers to opportunities to improve patient care and assist them in that process. Our ultimate goal here is to be viewed as a trusted partner in the patient care process, facilitate evidence-based prescribing, and serve as an educational resource for patients and providers alike. So what types of things do we look for when performing these population-based claims analytics? Overall, you'll see that there are similar elements to what we evaluate as part of our utilization management approach, but our scope is influenced by what level of data we have on hand. As with our utilization management elements, this slide is not exhaustive. It's a small but representative sample of the individual elements we evaluate when risk scoring populations for intervention. For example, on the pharmacy side, we look at high morphine equivalent dosing, doctor shopping, opioids with concomitant therapy, medication-assisted treatment or MAT drugs in combination with opioid medications, the presence of multiple short-acting and multiple long-acting agents, rapid dose escalation in short periods of time, and consistent early refills. When medical data is available, we're able to enhance and supplement our pharmacy data approach by looking at things like diagnoses, presence of respiratory disorder, history of opioid overdose, and a high risk of overdose without a prescription for naloxone. Now, the important thing here, too, is we provide these data points at both the aggregate and individual patient level when interacting with treating providers, so they have a full picture of their specific patients and overall prescribing patterns. This information is critical to empowering meaningful change in prescribing and improvements in patient care. We deploy our advanced analytics and academic detailing interventions on behalf of a variety of customers across all lines of business. This includes the most complex and challenging patient populations, such as those with serious mental illness. We currently provide academic detailing services in our very own seriously mentally ill or SMI managed Medicaid plan in Florida, and we have seen strong preliminary results for our algorithms focused on opioids. We used our proprietary analytics algorithms to identify patients above 120 MME and provided targeted in-person messaging to their providers using pharmacists with advanced training in behavioral health and pain management. As a result of our 4-month pilot, we've seen meaningful improvements in both pharmacy and medical utilization in our target population. For example, we observed a 33% reduction in members taking the high dose above 120 MME, with a corresponding reduction in overall medical spend of 45%. We look forward to taking the learnings from this pilot and deploying them across a broader patient population to leverage and see these same strong results. On the Medicare front, we've also been supporting CMS-required overutilization monitoring efforts for our health plan customers since program inception in 2012. We provide analytic services to identify potential overutilizers based on factors such as multiple prescribers, multiple pharmacies, and high MME. We then provide high-touch, pharmacist-led outreach to prescribers to review cases in depth and make recommendations for modifications to treatment plans. Our approach, coupled with formulary and point-of-sale edit strategies, has led to meaningful improvements in pharmacy-based opioid overutilization metrics in these populations. As a representative example, for one of our large Medicare clients, we've seen decreases in overall patients treated with opioids by 5%. We've seen a 13% decrease in members receiving high-dose opioids, a 14% decrease in patients receiving opioids from 3 or more prescribers and 3 or more pharmacies, as well as significant reductions, 87% to be exact, in patients meeting the CMS-defined criteria for opioid overutilization. Now, as with others in the industry, we at Magellan RX Management are proud of what we've done and continue to do in this incredibly important space. However, we also know that our work is far from over. To that end, we have a robust pipeline of solutions in the pilot stages and near full-scale deployment to our customers. Due to the sheer volume of activity, it's impossible for me to accurately portray everything that's on the horizon. However, I will briefly discuss and highlight some of the more innovative and immediately impactful areas that are under development today. For example, we are actively working on expanding and enhancing our existing utilization management strategy to address a critical area: opioid-naive patients, or those who have never been prescribed opioids. We are aligning with an increasingly common marketplace strategy of limiting initial opioid fills to a 7-day supply for patients who have never before taken opioids. We are also evaluating ways we can identify and intervene with members who experience multiple and rapid dose increases, as well as the best way to approach the management of cancer pain. Another key important area is drug storage and disposal. It's surprising to find that many patients actually don't know how to properly store their medicines or how to safely dispose of unwanted or unused medication. Removing unused supply from the community is critical to reducing the likelihood of exposure or ingestion by unintended recipients. To that end, we have deployed a many-layered, multi-phased pilot that involves drug take-back units and at-home disposal kits, in which we are proactively engaging patients to educate them on proper storage and disposal. If during outreach we find that a patient has unused supply and is interested in disposing of it, we direct them to local disposal units, or in some cases we will actually send them a free at-home disposal kit in which they open, add water, place the drug, seal it, and throw it right in their garbage, thus removing the dangerous supply from the system that they no longer need. Now, as we know, there are patients who do legitimately need opioids to control their pain. As such, the importance of proper treatment initiation and provision of support to them and their caregivers cannot be understated. Our Opioid New Start program aims to engage the patient in his or her care by providing education on risks and benefits of treatment, as well as how to identify signs and symptoms of potential dependence or addiction, and even more importantly, what to do in those situations. We also connect them with resources to assist them and make sure that they're starting off their treatment on the right foot. We accomplish this using a number of different modalities, including leveraging technology and providing direct outreach from our Magellan RX pharmacists and other clinicians. Now, finally, we have piloted an opioid support hotline in select geographies that is available 24/7 around the clock for our patients, their caregivers, who need help understanding their opioid treatment or getting connected with community resources if they feel addiction might be present. Now, all of these programs that are in development or already active for our clients and members, in addition to many others not covered here, represent our unwavering commitment to reversing the tide of the opioid epidemic that's currently gripping our country. Thank you for taking the time today to listen to what we at Magellan RX Management are doing to lead humanity to healthy, vibrant lives. All right, I'm done.